the challenge to eradicate or to prevent or even to cure infectious diseases is a major global burden.
Au niveau mondial, les infections résistantes aux antibiotiques sont déjà responsables de plus de 1,3 million de morts directement dues à ces infections. Imaginez maintenant en 2050, les Nations unies estiment que les infections résistantes aux antibiotiques seraient responsables du plus gros nombre de morts, notamment jusqu'à 10 millions de morts par année.
So MI4 was founded to deal with the threats to human health that infection and immunity pose, and to leverage the power of our immune system to deal with those threats. Every single modern medical innovation that you hope to rely on someday when you need it, whether it's surgery, chemotherapy, organ transplantation, none of it happens without antibiotics. And sadly, we are losing antibiotics. 1 in 4 infections in Canada is no longer sensitive to our first-line therapies. If we don't do anything, we're going to wind the clock back to the 1800s.
This project is one of the most important projects that we're going to accomplish over the next decade. We are building the very, very first Institute for Infection and Immunity in the entire world.
Why we need MI4 is because it transcends scientific silos, right? There are no boundaries in MI4. The boundaries are your imagination.
On a un besoin criant de nouvelles solutions. On voit que ce centre va ramener des gens qui n'ont pas nécessairement toujours pensé à la problématique de la même façon, mais en fait, c'est une bonne chose d'amener des perspectives différentes, penser un petit peu hors de la norme pour être plus créatif.
It's mixing economists with sociologists, it's mixing engineers with clinicians, it's finding those disruptive solutions.
So by bringing together these outstanding researchers from across the campus and the hospital and the research institute, the impact could be huge.
It would be wonderful to know that an MI4 team unraveled the cause of a disease, something that we have been perplexed about, and by bringing people together, we suddenly understand the cause, because once you know the cause, you can then work out the cure.
I think the pandemic taught us why we need to deal with this today, but it taught us how close we are to the tipping point, how easy it is for a new infection or an infection that suddenly becomes resistant to our current therapy, completely changing the game.
The future isn't around the corner, it is at our doorstep. And MI4 opens that door so that we're not watching it in another country or another center of excellence. We're bringing it here, we're making it here, we become the scientific experts, and then we figure out how that science translates into better medicine.
Vous savez, la philanthropie, ça fait toute la différence parce que ça nous permet d'injecter des fonds très, très rapidement pour permettre aux chercheurs de démontrer l'importance de la recherche.
Philanthropy is a key part of this. It gives us the space for our creative, blue sky, out-of-the-box thinking that nobody is willing to fund.
Chaque dollar que vous investissez dans ce projet permettra aux chercheurs d'aller chercher jusqu'à 4 dollars. You have the opportunity to join us today and help find cures to some of the greatest global threats to humanity.